Namaskar, I am Dr. Natarajan Meenakshi Sundaram, Senior Consultant Neurosurgeon and Spine Specialist, PRS Hospital, Trivandrum. So on the eve of the World Spine Day, I would like to have a discussion with all of you regarding the necessity and the need for knowing on the spine knowledge in our day-to-day life. October 16, 2022 is the World Spine Day. So this year, our theme is Every Spine Counts. There are about 33 vertebrae in our 33 spine bones in our body, which is very much essential in our day-to-day life. So this World Spine Day, which is falling on October 16, 2022, with the motto of Every Spine Counts, it is mainly to create awareness among the people because this is the leading cause of disability, the low back pain, which is the leading cause of disability in the entire world. The campaign calls for a greater global commitment to tackling spinal pain and disability by governments, public health organizations and NGOs and by communities. So the leading causes of back pain. What are the leading causes of back pain? They can be neck pain, they can be low back pain. So what are the leading causes for back pain, which is contributing to such a huge burden of disability in the entire community? So the commonest causes, the first is the degenerative causes of back pain. The degenerative causes means it is the cervical spondylosis or the lumbar spondylosis. So wherein which one could be attributed to the aging or a degenerative process, or because of the abnormal posture you can have a disc bulge which is compressing the nerve roots, resulting in pain and disability. That is the degenerative causes. Then you will have the traumatic causes. When you have any fall injuries, you can have any fractures, and residual deficits of the fractures can again result in back pain. And then you can have tumors, spinal tumors. So these spinal tumors can also cause back pain. Then is the infective causes. Infective causes means they are the infections. It could be the commonest thing in our country is the tuberculosis. The tuberculosis of the spine is one of the commonest etiology for causing back pain as an infective cause of the back pain. Then the other cause is the inflammatory cause of back pain, that is called as the ankylosing spondylitis or DISH, which is called as the diffuse idiopathic skeletal hyperostosis, or even rheumatoidal issues. So these are the rheumatological causes or connective tissue disorders. So these are the inflammatory causes of the back pain. So we have an degenerative cause, we have an infective cause, we have an inflammatory cause and traumatic cause, and the tumors, the oncological causes. So amongst these various causes, the degenerative causes of back pain is the most commonest one. And also we classify these back pains as mechanical and non-mechanical. The mechanical type of back pain is the most commonest type of back pain which we are encountering in our day-to-day life. So this is our spine. So on the whole, from top to bottom, so this is our cranial bone and this is our pelvic bone. So from the cranium to the attachment to the pelvis, there are about 33 vertebrae. Okay, there are a total of 33 spinal bones. So we divide that into 4 parts. That is the cervical, which is in the neck, then the thoracic, which is in the trunk, then you have a lumbar bone, which is in the back, which is in this region, and then you have the sacrum and the coccyx bone. So totally 5 things, the sacrum and coccyx are together attached as a single component. So on the whole, in the neck, there are about 7 bones. Okay, it is the cervical, it is called as the cervical vertebrae. And then over the trunk, you have almost about 12 bones. So this is called as the thoracic vertebra or the dorsal vertebrae. Then you have the 5 lumbar vertebrae, which is in the lower back. Then you have what is called as the sacrum and the coccyx. So it constitutes about 9 bones. So it's about 24 presacral bones and then the 9 sacrococcygeal segments. So in this, you have mobile segment and fixed segment. The cervical component, that is the neck part, it is the most is the mobile segment. Then coming to the chest, that is the truncal region, that is the dorsal vertebrae. These are fixed bones. Then again coming to the lower back, which is the lumbar vertebrae, which are again the mobile segments. So we have alternatively mobile segments, fixed segments, and then again the mobile segments. So this is how our spine bones are aligned. So in between these spine bones, okay, in between these are called the vertebrae. In between the spine bones, what you have is called as the disc. So this is a bone and this is a bone, and in between the bone you have what is called as the disc. So on either side of the spinal bones, you have this spinal nerve roots exiting at each level. Okay, these are the nerve roots exiting at each level. So this is the right side nerve root, this is the left side nerve root. Similarly, at every bone, you will have a left-sided nerve root and a right-sided nerve root exiting at each level. So what happens, the most common cause of the mechanical back pain is the disc bulge. Either the disc gets bulged and compresses this nerve root, or the bone gets slipped off, which is called as the spondylolisthesis. The bone gets slipped and that results in the nerve root compressions. So in case of disc bulge, so what happens is this disc bulges and it compresses over this nerve root. So suppose if here in our lower back, if this disc bulges and it will compress over this nerve root and it will produce symptoms or pain and numbness corresponding to that particular nerve root. So the same thing if it happens in the neck. If it is only compressing the nerve root, we may have pain along the one particular limb. Suppose if this disc bulges posteriorly, it compresses the structure what is called as spinal cord. So when the spinal cord gets compressed, then you may have weakness of the upper limb, lower limb, and both upper limb and lower limb depending on the kind of compression of the spinal cord. So the patient may have weakness of both upper limb and lower limb in one side, or weakness of all the four limbs. So in such cases, when there is a compression over the spinal cord, which can occur in the cervical related degenerative diseases, or it can occur in thoracic related degenerative diseases, you can have weakness of both upper limbs and lower limbs. So when the spinal cord is affected. So henceforth, with this basic idea of the spine, if you have any symptoms of neck pain radiating to one particular limb, either right upper limb or left upper limb, that is significant. When you have a neck pain radiating to the upper limb with weakness of the limb, that is difficulty in holding an object, difficulty in lifting the hand, or difficulty in combing your hair, or difficulty in buttoning the shirt, that is also significant. So a neck pain radiating to one particular limb and associated with weakness of one limb, it is significant and it requires medical attention at the earliest. When you have a low back pain, similarly, when you have a low back pain radiating to one particular limb, that is again significant. When this low back pain is radiating to one particular limb and associated with weakness of that particular limb, that is difficulty in holding your slippers. When you are walking, your slippers might slip away, and when you are walking, your gait may be changed. So when you have a low back pain radiating to one particular limb, associated with any numbness over that particular limb and associated with weakness of that limb, that is again very, very significant. And accompanying these all features with the back pain, when you have difficulty to urinate and difficulty to defecate, that is a medical or a surgical emergency where you need to have an immediate medical attention. So there you may have significant nerve root compression, and there are chances of irreversible nerve damage where even after doing the surgery you may not have adequate benefit. So when the moment you have these symptoms, it's time that you seek the medical attention at the earliest.
ARS Hospital. Care like only a mother can give.